Hello everybody, we are live, first time. Aurora Miller is doing microblading. There she is.
Hello everybody.
And we are recording for the first time, so we don't have any practice. We just thought, oh, let's try this. So Aurora and I, sisters, both RNs, have been doing microblading and permanent makeup and paramedical procedures for a few years now. And this little lady has already had her tracing and the anesthetic. So right now you can kind of see how things are going. So microblading is a set of needles. In this case, it's 12 needles in a row. That is why it's called microblading, because it looks like a blade. Should not be used like a blade. This is not to be deep slashes on the skin. It is only supposed to be to the dermis. That's the second layer of skin. Very difficult to really determine that you really are on the second layer unless you've had a few years of experience.
What I just did, I did a second strokes on each eyebrow, and now I just put more anesthetic with the pigment on it, so I'm going to let that sit for a few minutes and then wipe it off, and you'll be able to see the after effect and more anesthetic on it.
My battery is dead on my iPad, so I'm having to keep it connected and to the wall, so I can't move around much.
Was it painful?
She knows what to say. She's been told to make sure she doesn't say that it's painful.
No, it wasn't. Was it painful?
No.
Oh, now we have somebody that connected. Lillian. Hi, Lillian. Cool. My friend will do it myself. Great. We don't know how this all works, so thank you for
Come and look at
connecting
this
with
side,
us.
Maria.
So this is the first pass after the tracing, and so you can see how things more or less look while why do we have that light? Can you get the light on? Okay, so you can see how it looks more or less as we get started. So she had the tracing first, then the anesthetic, and this was the second pass. It looks very, very good already.
Yay.
It looks really, really good. So this is going to be the third pass now, after the cleaning that pigment out. I guess I'm in the way here, sorry.
And we use green soap to take the pigment off so it doesn't, we don't rub excessively on
Turn your head this way just a little.
on the tissue so it doesn't agitate it so much.
Now guys, look really careful if this can focus here. These are not deep slashes. It is only to the second layer of skin. Very, very difficult to determine that unless you have some experience. You should not see deep slashes on the skin. It should be very smooth, no jagged strokes. And should have really good results. Here, let me disconnect it. Oh, your torn up jeans just came on the picture here. All right, I disconnected it so I can stand on this side for a little bit.
Maybe you can connect it on that side.
No, I guess I'll be okay for now, for a little bit. This was unplanned, so we really, again, my battery is almost gone, and we didn't know we were going to do this, so we thought we'd try it out. We had a generous client that said, okay, go ahead, do it.
I'm going to sit her up so I can see.
Judy. Hi, Judy.
I'm going to sit her up, Maria, so
Yeah,
I
go
can
ahead.
see the shape.
Yeah.
So if I need to tweak it,
Yeah.
I can tweak it. And
Hey,
if
Judy,
you want to look
Judy
at it.
Roll is online. She's one of my
Sorry.
clients.
Oh, wow.
Oh, I guess I shouldn't have said that, Judy. I'm sorry.
Very nice.
Mhm.
So this is only the second, after the tracing, the second pass. So starting the third pass. As our daughter keeps microblading, it starts looking better and better. It starts filling in and looking like what we want it to look. Now this little lady has hardly no hair on her eyebrows. So when she leaves here, nobody should be able to tell that she had any tattooing done on her face. It should look that natural. And I know that a lot of people see or go to classes that have had, that are shown on paper how to do a design. There is not one person that's going to have the same strokes in our facility because nobody's hair grows exactly the same. Unfortunately, this old lady has no hair, so we are creating our own design. But if you have some hair, we follow your hair growth.
And what I'm doing is I'm just filling in the hairs as I go to just fill them and make them fuller.
And I just zoomed to that. Did you see that? I zoomed it. That looks nice.
Let's do this side. Now, I'll probably have to go a little darker if you'll look at your eyebrow on this side. If you see how very light it is,
Mm-hmm.
and when that scabs over, if you lose that, you might not see it. So we're probably going to go to the next color. Okay?
Now, because we are both registered nurses and have been most of our lives, we still treat our clients like patients. We do not do anything without consulting with them. There is no power struggle here. We do what the client wants us to do unless it is something that is very unrealistic, and then we just send them somewhere else. But that's only happened about 3 times in 4 years. We are very in tune with their discomfort. We stop immediately if they are having discomfort and apply more medication. Some of our clients might have some anxiety disorders, and we allow them to get up and walk around or do whatever they need to do to calm them down. We also have a peppermint diffuser on all the time because peppermint helps patients relax. Or chamomile tea, which we can provide for them here too. Now, judging by this little lady's lips, she's really trying not to. She's working up those lips. She's trying not to make any suggestions that she's having any discomfort.
Are you hurting?
I can feel it more than the last pass, but
Okay. You can tell her to say the truth because she won't stop unless you tell her.
Yeah, because if you tell me that it's still okay, then I'm just going to keep going.
Yeah, so more medication is going to go on right now, just because she did admit that there is some discomfort. So there's more medication. We do it at least 2-3 times before they are really, really numb. You can kind of tell when a person is numb. If you look at this eyebrow, see the flushed area around the eyebrow? It's
There's
really
some there.
flushed. that tells us that they are pretty numb, and that doesn't mean they're not feeling some discomfort. I mean, just having some anxiety is going to be playing a part on that, but she should be pretty numb as it is right now.
I'm going to step up the color just a little bit darker because the first strokes were too light. So that'll give it just a little bit more color to them eyebrows.
Once the skin is opened, it is, the anesthetic works really, really fast within seconds. So we don't have to keep the anesthetic on for too long. Oh, Judy, you asked, are we in Brandon? Yes, we're still in Brandon. We're at 302 West Bryan Road. That's right on the, what? No?
It's 302 Bryan Road.
Oh, just Bryan Road, sorry. We still don't know the address very well. It's on the corner of Lithia Pinecrest and Bryan, right off of 60. You can almost see us from 60. And Lillian, you were asking if we're in Florida. Yes, that's the address we just gave, and that is Brandon. So I answered for you. Oh, I see what you did. Judy says, I figured you were busy, so I answered for you. Yes, thank you, Judy. Hey, aren't you supposed to be working? I know you're supposed to be working. You have banker's hours.
We're just going to let the anesthetic...
oh, sorry.
We're going to let the anesthetic kind of take effect a little bit more because I didn't wait long enough for the time that I left it on there. I did add a little bit more darkness to the color I started with because when I wiped them, as y'all could see, it was a little bit too light. Some people do like it light, but if we leave them too light, of course, and when she starts scab or peeling in 3 to 5 days, she'll lose that top layer and it'll be even lighter. So I just increased the color just a little bit more, so it'll intensify the depth in that color. So she'll look at them again and let me know if that's okay. If she wants them a little darker, then we'll step it up to the next darker color. Yeah, we won't go too dark, but yeah, but she already saw them once and she liked the design that's turned out. So, and the procedure takes about 2.5 hours. And it's little steps, little baby steps, because you want this perfect. You want it done right. You don't want to rush into it. This isn't a 20-30 minute job. We take our time with our clients. We want them happy. We want them satisfied with whatever we do.
Not like what I had done 17